Hello, everybody. Welcome to the 12th Annual International Stigma Conference at Howard University. This year's theme is trauma, recovery, and healing. This is our second virtual conference, and we wish we were in person, but we're going to do it virtually. We had an awesome time last year, and you had a full year to learn how to use everything virtual. And so I hope you enjoyed our slideshow from our past events before you came in. And so I want to introduce you to the platform. If this is your first time using the Hoover platform, we used it last year, like I said, but this year it even looks brand new and fun. And so we had a whole year of working online, socializing. So I know you probably have this technology down. If you're not using the app and watching us online streaming, please download the app. It's so much more of a richer experience if you use the Hoover app. And if you are online and you're watching, please hashtag Stigma 2021 when you're posting anything across any of your social media platforms. And you can find us at Who Can You Tell across all social media platforms. When you registered, you received a link in the email, and that link can get you to and from the conference. If, say, you're on the road and you need to get back and you don't have the app, just click the link and it will bring you back. Again, I encourage you to keep using the app. You can check out some of the conference art, the abstracts, the posters, the exhibitors. You can chat online. You can find our community board online for announcements, ask our organizers questions, chat boards. Just keep the conversation going, even after the conference is over today. And after it's over next week, we'll still be online. So let's keep this community going. Our virtual booths are found in the exhibitors section. Please support them. They are supporting us, and so we want to support them. And there's lots to check out. You will also notice there's a leadership board that tabulates our engagement, gives you points depending on how active and engaged you are during the conference. The Howard University Stigma Project is offering gift cards to the top 3 leaders on the board at the end of the conference. And we're only going to recognize the leaders who are active, engaged participants, and not folks that just keep reposting to receive points, even though we do like reposting. And in speaking of gift cards and prizes, if you attended our conference before, you know how we like to break things up and do a little entertainment and give away gift cards and raffles. So this will be no different than before. We will be giving away $50 Visa gift cards each day. So stay tuned for that. You will also be receiving session evaluations. Again, this is no different than any other time that we've been together. We really do appreciate everyone who fills these forms out. It has helped us plan the next event, the next sessions and speakers. And so we really do need you to fill these out after you attend your session. And then after the event is over for the overall conference, please give us your input. This really does help us. And next year, really hope that we'll have a hybrid conference if we can, and maybe we'll be able to see your beautiful faces in person. So please help us fill those evaluations out. Also, if you've registered for a CEU for social workers, these credits, they're still available, but you need to officially have registered. There's no extra charge, but you do have to be a paying conference attendee, and you know the fee is nominal, so not a big deal, but just make sure you're registered. And you can do that at whocanyouTell.org. Today's conference goes to 5 o'clock Eastern Standard Time. And again, check the community boards for any changes, announcements, you have questions, maybe you catch a video depending on what country you're in, because as you know, This conference has had more than 70 countries visit us at one time during our conferences over the last 12 years. So we know that there is some time differences for everyone. Now, that takes care of our announcements. Let's get this 12th annual International Stigma Conference at Howard University started, okay? Please welcome Howard University's President, Dr. Wayne Frederick. He'll be followed by Provost Anthony Wutau, who will give our welcome. And that then followed by Mr. Henry Fuller, a senior capacity building assistant manager at Health HIV, who will bring greetings. Concluding the opening session, we will have our very own Dr. Sohail Rana from Howard University Hospital, who I am one of his biggest fans. So please stay tuned for the rest of the opening and this awesome day, and I will see you back here.
Hello everyone, welcome to the 12th Annual International Conference on Stigma. I would like to thank you all for attending this important gathering, and I would also like to express my gratitude to the Howard University Stigma Project for the impressive and essential work that you all do. Fighting stigma is a fundamental component of Howard's mission to pursue social justice and equality. For these principles to be enshrined in our laws, we must simultaneously eradicate prejudice and bias from our society and from our consciousness. The willingness to stigmatize has catastrophic consequences for the individuals who are victimized by stigma and for the society we all live in where stigmas are allowed to persist. The giving of care must always be personalized and individualized, but a person who is stigmatized will never receive care that is attenuated to their unique needs. When prejudice influences a physician's diagnosis, the needs and circumstances of the patient are often disregarded or willfully ignored. The patient does not get what they need, and society is deprived of all the good that that person might have done had they been given adequate support. A society can only achieve its fullest potential if each individual person who compromises it is empowered to do the same. When a person is stigmatized, we are actively diminishing their potential by reducing the possibilities for what they can and may become. But when we eliminate stigma, and when we see and allow each person to be seen and heard for who they are and who they can be, then our society will be lifted up by the momentum of people who are liberated to test the fullest reach of their capabilities. Where stigma is a flattening of a person's humanity, justice is the amplification of it. As a society, we must commit to apportioning support based on a person's level of need, not on a false sense of equality. To achieve true equality, where each person has the same opportunity to discover their true selves, we must first establish the structures of justice. Certain groups of people, those who suffer from HIV or mental illness, Black individuals and people of color, LGBTQ individuals, Americans for whom English is their second language, are victimized by stigma more so and differently than other groups. In response to their stigma, they endure, they require different levels and types of support. The Howard University Stigma Project is helping us see people for who they are, helping us recognize our biases that exist in ourselves and others so that we may correct and eliminate them. Once again, thank you all for participating in this critical work and for engaging in these essential conversations. May we shine a light on stigma now so that we may eradicate stigma in the future.
Hello, I'm Dr. Anthony Wutau, and I currently serve as the Provost and Chief Academic Officer at Howard University. It is certainly my honor and my pleasure to welcome you to this International Conference on Stigma. I was just recently reflecting that this year marks the 40th anniversary of the identification of an illness that we later came to identify as AIDS. And so we are 40 years into a global pandemic, but I'm certainly proud of a lot of the progress we have made in the diagnosis and the treatment of HIV/AIDS and medical advances leading to the prolonged lifespan of individuals living with AIDS. But we certainly still have much work to do to help to address issues of stigma that individuals living with HIV and AIDS are still addressing. As an HIV researcher myself, I'm certainly proud of the progress that we have made, but I also acknowledge that there is still much work to do. And so, again, thank you for joining us, and I look forward to engaging you in this very important conversation.
Greetings. Welcome to the 2021 International Stigma Conference. I'm Henry D. Fuller, Senior Capacity Building Assistance Manager with Health HIV. I offer you a warm welcome and greetings from our ED, Brian Huddich, as well as our entire Health HIV team. This year's conference theme is Trauma, Recovery, and Healing. With that, I would like to share my personal story. I am a Black, same gender-loving male that grew up in the Deep South in Jackson, Mississippi. I'm the grandson of sharecroppers from rural Mississippi, the son of factory workers from Jackson and Canton, Mississippi. I graduated from Jackson State University with my master's in urban and regional planning and my bachelor's of political science. One of the blessings about attending an HBCU is the care that is taken with each student. I'll share with you, I can remember as a freshman, one of my professors asked me a question. Who am I? Of course, you can imagine I responded to my professor with very colorful comments. But we concluded that we are simply merely a total composition of our life experiences. That nugget of wisdom empowered me for the work that I would be doing. When I left Jackson State University, I was honored to be city planner of the city of Jackson, Mississippi, where we work each and every day to improve the quality of life and services that citizens receive. I was tasked also with ensuring that individuals with HIV had housing opportunities. While at the city, I founded Citizens Under Guidance Acting for Sustainable Progress in response to being an innovative solution, developing tools to respond to the oh so unique needs of various vulnerable populations in Mississippi. I went on to work at My Brother's Keeper, where we worked each and every day to develop innovative solutions to ensure that individuals would stay in care and would get preventive care and services that were needed. As a result, we were able to develop a state-of-the-art clinic where members of the LGBTQI community could feel empowered as they got the services that they need to live their best life. As part of my duties at My Brother's Keeper, we will often host testing events. I decided, or rather challenged my partner at the time to get tested with me. We went to the testing event, and the results were, I was negative, he was positive. At that moment, I had to make a very hard decision. Would I support my partner at the time, knowing that he did not have a support system to get him through this very trying time in his life? Or would I extend the trauma, the hurt, and the pain many other members in various communities experienced when they got their diagnosis? I decided to support my partner, and as a result, he became undetectable. I was first introduced to the words trauma, discrimination, and stigma as a student of Dr. Bob Moses. I would often go to Dr. Moses with challenging questions, and he would just simply respond, Henry, to make a difference, you don't have to start a movement. Effect change by exemplifying the change you want to see in the world. I've taken that wisdom with me in every capacity in which I serve. As Senior Capacity Building Assistance Manager with Health HIV, I work each and every day with beautiful citizens to develop innovative solutions to respond to need in these very trying times of COVID-19. As we go through our activities this week for the conference, dig deep, ask yourself, who am I? What have been my life experiences? And how can I use my personal story to empower the work that I do each and every day? That is how we will exemplify the change we want to see. That is how we will end trauma together. That is why we all will heal, highlighting the commonalities in which we share, and ultimately recover from the various levels of hurt and pain and trauma that we've experienced as human beings in this world. Again, welcome to the 2021 International Stigma Conference, and I look forward to our engagement.
Music band. Band for young people participating in affected with HIV, and we use our talents to create a positive impact in our community. This is Michelle.
Eric. Vegan Techniques.
We are from Uganda. You can follow us on our social media platforms. Y Plus Music Band 256 on Facebook, Y Plus Music Band on Instagram, Y Plus Music Band on Twitter, and our foundation is the Young Horses Foundation. Thank you. Enjoy our performance.
Stand up, all the nations rise up. Let us speak up about HIV. We must wake up, everybody team up. Let us join our voices to fight HIV. There's no more need to cry. No need to cry. All we need is to rise up. Let's rise up. Sensitize people about HIV, as well as helping those within.
The time is now for us all to break the silence. If we truly want to reduce on the death rates of our people dying of HIV and AIDS, then it's high time we go and create awareness among the people around town and those in villages when HIV is still perceived the death sentence. Let us encourage them to debunk their sexual myth. To me, I think this will make more sense when everybody goes for bloody testing and freely discloses the haters. We must stop closing eyes to the truth, because we ought to tell the facts, not the lies. We don't have to sit down and wait for government. I mean, together we can fight HIV to the end.
There's no more need to cry.
Good morning, everybody. Good morning from Washington, D.C. Assalamu alaikum. Namaste. Shalom. It's a beautiful, sunny, but chilly day in Washington, D.C. I'm sitting in my office where I've spent last 41 years uh, taking care of the community. This is a home away from home. And I feel so blessed and so overwhelmed with gratitude that something very small that we started 12 years ago, thanks to all my wonderful family at work, as well as my family at home that include my wife, Gila, my close associate at work, St. Elmo, Lisa, and so many others that if I start naming, I'm sure to leave some out because so many people have helped us along the way. So I feel truly, truly honored and blessed that 12 years later, we are still doing it. I just want to share a little bit about how I got educated about stigma. I really didn't know anything about it, even though we were hearing and using the word of stigma being a big barrier in treatment and adherence and testing for HIV. And this was 1997. And it was on the front page of Washington Post, the Hansen Center in Carville, Louisiana, which was really the leprosy home for most of our country, where anybody who was diagnosed with leprosy, they were sent there, was closing. And as it was closing, there were still 135 residents when it closed. Most had been there all their lives. Some were brought there at 5, 6 years of age, some 20, 30. Husbands had been separated. Some were brought handcuffed with guards, making sure they don't interact with anybody else. They were not allowed to leave. It was a prison, really. They could not ride public transport. Actually, some states banned that they couldn't fly over those states and they could not use public bathroom. Husbands and wives were separated and children taken away from their parents. And there were some beautiful story that Washington Post, and one thing still sticks, and this was a story of Miss B. Miss B was a daughter of very rich family. She remembers a huge car that her parents owned. They lived in New Orleans. Her father was a very influential person in the local politics and national politics. And one day, a chauffeur and her father took her to a doctor. And she just remembers them whispering. And they drove after that for a good half an hour, 45 minutes. And then she was at this door, walked in there by a chauffeur. And that's the last she remembers. She turned back and her father was looking elsewhere. He was sitting in the car. And when this house closed, this center Carville house closed, she was 72. And since 9 years of age, she never saw her parents. So, and my own daughter at that time was 9 years of age. And believe it or not, I just sat there and tears started running through my eyes. How could anybody do it to another person, to a 9-year-old? I could not fathom it. I could not understand it. So, brothers and sisters, that was my first true understanding of what stigma can do to people and how people can stigmatize others just because of fear and idea that it would shame their family if anybody found out that their family had leprosy, and they wanted to get rid of that shame by putting away their daughter in that leprosarium. Time passed by. Over the last 35 years, I've taken care of close to 100 children with HIV, maybe 200 children with sickle cell, and many other with mental illness and chronic illnesses. And as I asked people and I talked to them over and over, I could not believe how people with disability, how people with mental illness, how people with HIV, how people with sickle cell, how people with obesity, how people who had had an encounter with the jail system, how they got stigmatized and how they got devalued and how they got looked down upon. Somebody, we are all created equal in the eyes of God with all equal rights. How could society be so unjust, putting down some people as if they don't have any value at all? So especially with HIV, it really broke my heart, because many of these children that I started taking care of at birth or a few years after, they lost their parents, and many of them called me their dad. And Chelsea was one of them, and I'll share her story with you. She really used to call me dad, and she would call me dad in a very funny way with many D's at the end. And Chelsea had a great sense of humor, and she wanted to be a comedian. She would make us all laugh, but behind her laughter was a very, very broken heart. She several times told me she hated herself, and she knew nobody would ever love her. And how can she ever have a family? And how can she ever have children? She says, why? What am I living for? Who would marry somebody with HIV? Her family itself had made her feel dirty. Nobody else knew except her close family that she had HIV. They would clean her chair with Lysol. They would wash her dishes twice and separately. And she had only one close friend, a cousin, and she could tell her friends everything. And this friend was very supportive all the time. So one day she got the courage to tell her best friend that she has HIV. And the friend talked, and she said such nice words. And Chelsea felt good, and she got up to leave. And as usual, she wanted to give her friend a hug. But as Chelsea moved forward to hug her, her friend moved away. And that broke Chelsea. That broke Chelsea completely. And that day, Chelsea stopped taking her medication. She could have lived forever if she took her medication, but few days after she stopped taking her medicine, she passed away. And you can see Chelsea did not die of HIV. She did not die of an opportunistic infection. She died of stigma of HIV at age 19. And I just can't forget. And I can't forget many of my other children. All of them suffered stigma in almost every facet of their life, at school, at work, with their family, with their friends, in their struggle to disclose their diagnosis to their loved ones, to their friends. And there are people who could never tell anybody that they have HIV. And that's how the name of our website, who can you tell, .org, we could see that all stigmatized illnesses, people could not tell anybody their diagnosis, period. So in my experience with HIV, sickle cell disability, and mental illness, these illnesses that are stigmatized tremendously, it causes major trauma for the patients and their family. Even unfortunately, this stigma starts in healthcare facilities, because we are as ignorant as anybody else in the community. And this stigma, once people feel stigmatized or they anticipate stigma, it becomes a barrier to care. They don't want to go back to see the doctor. Many of them, they don't want anybody to find out that they take HIV medication or other medication for illnesses like psychiatric illnesses. And stigma destroys their mental illness, their mental health, and it destroys their lives. Rebecca was 35, and one day she came to my office with her daughter who had been diagnosed with HIV. And Rebecca, she had not given her child medication or brought her child back. And I said, Rebecca, what happened? You promised that you will take care of your daughter. She says, Dr. Rana, you don't know my story. And she started crying. Says, I was in the labor room, and I was going through labor that would not progress. And they convinced me that I needed a C-section. And the C-section was to be at 8 o'clock. And at 7 o'clock, my results of HIV test came back, and they found out that I have HIV infection. And it was 8 o'clock, and then it was 9 o'clock, and then 11 o'clock. And I kept calling the nurse, kept buzzing, when am I going for C-section? When am I going for C-section? And they kept saying, oh, we are still trying to find a doctor who would operate on you. She said, they made me feel so dirty, so untouchable. Anytime I come close to a hospital, my heart starts beating, and I have this dirty feeling. And that's why I don't want to go to any doctor. So, my brothers and sisters, stigma is the attitude and behaviors that devalue a person because of an attribute. And stigma remains a major barrier to access, treatment, and well-being of individuals living with stigmatized illnesses. Certainly, nothing like leprosy, nothing like HIV, nothing like mental illness, nothing like obesity, but almost all different illnesses that where person gets blamed for their illness, they get stigmatized. You saw how Ebola got stigmatized, and most recently COVID-19 got stigmatized. So stigma is the game of fear. People, unfortunately, despite all the advances in knowledge, despite the fact that they know, or many people know, that they can't catch HIV by sitting on the chair next to a person, or they can't get HIV from touching or kissing or hugging a person, and they can't get HIV now, even for all practical purposes, even by cohabiting and having sex with the person. If the person's viral load is undetectable, people continue to be afraid. They put the blame on the person for catching that HIV, and the person who has HIV or another illness, they continue to feel ashamed of their illness and hiding their diagnosis, making sure, spending all their energy in hiding the diagnosis of their illness. So there are different kind of stigmas enacted, anticipated, and you will hear over the next 4.5 days about these different kind of stigmas. Among the one that hurts the most is the shame, and that's the last one, internalized stigma. Where does stigma come from? It is from our interpersonal interactions, communities, structures, systems, media, almost everything. It feeds into it, but unfortunately, many of time, stigma gets started in healthcare setting because we do not know how to communicate health information in the best possible way. So what about intersectional stigma? That term is being used over and over. Intersectional stigma is this where these other factors like poverty, being of the female or transsexual, gender preference, addictions, race, being black or of another race, which is not the end race, and history of incarceration, they add on layers and layers of marginalization to those already suffering from stigma. So this is, if you look up top, these are the usual stigmatized situations, and it leads to harassment and abuse, poor health services to people, poor emotional well-being, marginalization, poverty, and this poverty feeds into everything else, and people get even more stigmatized, and there is discrimination. Many people experience violence, especially in partner situation, and there are many people who commit suicide because of their stigmatized illness. So stigma is one of the biggest public health problem that is ignored, unfortunately, by many leaders and institutions, because pharmaceutical companies want people to be getting medications, very little money going into research for stigma, and certainly very little money going into taking care of the problems created by stigma and educating people. So today and next 4 days, the organizing committee has prepared an outstanding program to explore different kinds and different aspects of stigma and their potential solutions. I am sure I'll learn a lot. Every time in conference, I learn a lot. And believe me, I sit and cry sometime in the audience openly when I listen to the stories. They're very touching, but at the same time, they are all sharing their story to make us a better human being. And I'm grateful to all the members of organizing committee, especially Patty, Cynthia, Sahir, Nana, Zainab, and Jaden. And especially, I go to my home again, Patty, she's really put this all together. And at my home, Gila, my wife, if she had not supported us all through these years, these conferences would not be possible. I really implore you to try to attend as many sessions, and I'm so glad you're here. God bless you all. Thank you very much for joining.